Welcome everyone. Hi, I'm Dr. RMD, and this is Team RMD, Dr. Rupal and Dr. Manoj. Here we are at session 5 of JuxtaMed quiz, which is the NEET-PG bar INI-CET quiz, which is held frequently on YouTube Live and AHA Slates platform. This quiz is for NEET-PG bar INI-CET PYQs, and it's a form of entertainment. So uh, let's dive into today's topic. So, are you ready?
I hope
Team,
we
are you
are all
ready?
ready. Let's go.
Okay, so let's move on to the first question. Here is the first question. Which of the following is not an olfaction test? Options: Arnold's stick test, sniff test, smell biscuits, and UPSIT. You have to choose one of the following options.
Honestly,
Well,
I
Arnold's
think,
stick test isn't a yeah.
yeah, I think it's a prank tool. Oof. Yeah, people didn't fall for this prank.
Yeah, so Arnold's stick test it is. So let's see the leaderboard. We have Ashish, who is leading right now, followed by Vamshi and Soumya. We have two candidates with same name. Both are at third place, along with Narasimha. Three candidates are at the same spot.
Soumya, are you the same person? Are you from two different devices?
Okay, let's move on to the next question. So the next question is, what is the narrowest part of the nasal cavity? Options: rhinion, inferior turbinate, Lyman nasi, alar cartilage.
I know the fact
narrowest
that,
part is
yeah,
the rhinion. It's special for airflow dynamics,
and for why some
right?
reasons sound like they are whistling through their nose when they talk.
Yeah, so the
I
answer
think
is
we got
rhinion.
three of them selecting rhinion.
Yeah. So, so yeah, we have 17 people who have got it right. So yeah, let's see the leaderboard.
Vamsi.
Oh, this
Vamsi is the return. I mean, it's like,
Vamshi is one of the winners. Malcolm is also one of the winners.
hmm.
Okay, so let's move on to the third question, shall we, team?
Yeah, let's go.
yes, yes, sir.
Third question. What is the main epithelium lining of the nose and sinuses often called?
It's pseudo-certified ciliated columnar epithelium, also known as respiratory epithelium.
Uh-huh. I think then that name is longer than some medical degrees.
Yeah, that's true, but it's vital for mucociliary clearance, keeping the airways clean.
It's like having a mini cleaning crew in your nose.
Yeah, and see the answer. The answer is respiratory epithelium. Excellent.
Excellent.
We have 13 candidates who have answered it right.
Hmm. People know.
Let's move on to the leaderboard. Vamshi is rocking with longest streak. It's 3 streaks in a row. Congrats, Vamshi. Followed by Saurav. At third place, we have Tamzil. At fourth place, Morris. Fifth place, Sanmuga Priyan. Sixth, Ashish. Seventh, Nirmal. Eighth, Soumya. Ninth, Pranav. And at 10th, Vijay. I guess most of these names are new names, isn't it?
Yeah, they look same. I mean, sorry, they
Yes,
look
sir. I
different.
think yeah,
So we have many new
there are
candidates who are
many new
joining the
players, I
quiz,
guess,
which is
this time.
yeah.
Yeah.
That's
Hmm.
interesting.
Let's see how they perform in the upcoming questions. Here is the fourth question. Associate the meatus, openings, and drainage of the paranasal sinuses.
The frontal,
The
maxillary, and anterior ethmoidal sinus drain into middle meatus, while the posterior ethmoidal drains into
superior meatus.
superior meatus. Yeah.
And the sphenoid sinus. Do you know he's the VIP? He's draining into the sphenoethmoidal recess.
Perfect.
Yeah.
So
Special entry.
remember, knowing drainage pathways is very crucial for diagnosing conditions, especially in sinusitis. So time's up, and great work, team. So let's see how our candidates have performed. I guess very few of them have got it right. Only 6 of them. I think most of them might have got it partially right.
Could have been, could have been.
Yes,
They
sir.
must be scored accordingly. So there's partially right for the people as well. See?
Vamshi has come prepared.
Vamshi is, yes, sir. He's currently
I
leading.
think he will be the first candidate to win the winner title twice.
Twice. Okay. I think he's gonna keep his long streak. We have to see.
Let's move on to the next one. So here is the 5th question. Lamina papyracea is a part of which bone? Any
I
guess?
think,
One word, Rupal?
yeah, I think it's a part of the ethmoid bone forming the medial wall of the orbit. I think it paints a picture.
It's so thin, it's called papyracea, like a paper.
Oh, okay. And that's why orbital cellulitis can quickly spread from the sinuses.
Yes, so paper thin,
Yes.
but clinically thick and significant.
Wow, awesome. So the answer, in fact, is ethmoid bone. Bravo.
Let's
see the leaderboard. As expected, Vamshi has come prepared.
but we can see Soumya has returned.
Exactly. Followed by Ashish, Saurabh, and Nirmal.
I think Ashish is always in the second or third, sir. I think in 2 or 3
Exactly. Yeah.
previous quiz.
I think he is a bit unfortunate to get into the top at top 1.
Yeah.
Let's see today.
I think the future quiz can be an opportunity for you, Ashish. You can turn it. Let's tune.
Yeah.
So here is the 6th question, and this is one of the toughest questions. Which of these does not form the nasal septum?
Oof. I remember.
Options could include the woman, perpendicular plate of ethmoid, septal cartilage. Anything else doesn't belong.
Me trying to do ENT surgery.
Exactly. That's why anatomy is so important. Great job. So it's lacrimal bone. I think this is one of the very important PYQs which is asked frequently, and the one which is very difficult to remember too.
No, I think there is a trick to it. And if everyone wants to know, we'll let you know in the explanation part.
Good.
Vamsi, the streaker.
Followed by Nirmal. I guess Nirmal is a new candidate. We haven't seen him in the scoreboard so far. Followed by Saurabh, Malcolm, and Morris.
Well, welcome to all the new candidates. Guys, this is good to see that, you're up to the speed. You're also competing. Let's go.
Move on to the next one. 7th question. So this is a clinical scenario. Let's solve this case. A 25-year-old patient visits ENT OPD and he has DNS on incidental examination. Portal stage, there is no significant improvement. So what is the next best?
Which?
Okay, see the question clearly and follow it step by step.
Clinical cases always keep you, on your toes.
And what is this? No
Oh, I
intervention?
think this is
Oh my
a.
God.
I
So
think
now,
Imagine.
can you see
the
that
question's importance is,
exclamatory
yeah.
emoji? So few people are like, how can the answer be no intervention?
Oh,
This is a
see,
bouncer for them.
I guess in this, most of them got it wrong. That's why you see Vamshi, Nirmal, and Saurav's scores are still the same.
So it shows that
Hmm.
Pranav has done his homework.
Exactly. Right. Pranav has 3 streaks continuously. Nice.
Wonderful.
Next question. So this is regarding X-ray. So what is the name of this X-ray view?
Based on the image, this seems to indicate, I don't know, this is always a confusion for me.
I remembered them, where the
What do you think?
sinuses are located. So I'm giving you a hint, guys.
Hmm.
Sinuses, and you'll know the X-ray.
God, well, these questions are always confusing and they're so important in exam. Every time in ENT or radiology, one of these
Hmm.
questions will always be asked.
That is true. They love it.
And they know that we are confused in this.
In
What a
this.
loophole.
So we have Vamshi who is leading. I guess if Vamshi continues this streak, no one can beat him. Followed by Soumya, Nirmal, Saurav, and Pranav. Great, guys. Let's move on to the next question.
But guys, you can beat them by being quick. So just go.
Another X-ray. Wow.
See, guys, if you know the first one, you'll know the second one because it helps you to rule out the first one, no? So,
I think there's an arrow mark also in this,
yeah.
which gives a clue.
Hmm. Yes, yes, sir.
So it is water sway with closed mouth. Okay, we have two options with open mouth and closed mouth. This can be a pretty good question for upcoming NEET-PG and INI-CET.
I do
Closed
actually.
mouth wave and an open mouth
Hmm.
wave.
Yeah.
And everyone will know it is water sway, but they won't
Yes,
know whether
yes.
it is closed mouth or open.
Hmm.
People are picking up the paces.
Yeah. Okay, so let's move on to the last question. So it's a different type of question. So here is your 10th question. It's a riddle. So
I work in silence, though I am in your head. I am in your nose, but I don't breathe. I send signals without a word. Guess who am I?
I think the answer could be olfactory epithelium or even the cranial nerve one,
Cranial nerve.
because
People
both
did
are
get
actually similar.
confused.
Hmm.
so it could be very confusing for few.
This is
Hmm.
okay.
So the answer is olfactory epithelium. A great funny way to wrap up this quiz with a riddle. Yeah, so that's all for today. So let's see the leaderboard. As expected,
Ah,
Vamshi has become the first candidate to win the two titles of winner in JuxtaMed quiz. Congrats, Vamshi! It's a
right.
great going. Okay, you'll be shining in the upcoming NEET-PG or INI-CET exam because uh, participating in the
Yeah.
JuxtaMed quiz and winning among these participants is not an easy task. It demands a lot of effort and dedication. So, congrats, Vamshi. Looking forward to your participation in upcoming quizzes also.
It's congratulations, a big, big congratulations. You're holding a streak and the winner place. It's quite appreciated. If you want to, let's see if you can, win the next one. Because we are also leveling up. And let's go to Saurabh. Saurabh, congratulations for being the second. Ashish has come back in the play. So congratulations to you as well.
At fourth place, we have
Congratulations,
Soumya.
guys.
followed by at 5th place
Yeah.
Nirmal, and then we have Advik. 7th place we have Tamzil, at 8th Malcolm, at 9th Vijay, and at 10th Pranav. So we have many candidates below this also. So I think top 10 will matter the most, and top 3 will be featured in the upcoming quiz prize distribution ceremony. So right now we'll be having a short prize distribution ceremony of previous session, followed by explanation part of today's quiz. So please come on YouTube live for the explanation part.
Okay. Guys, I would like to give you a very small insight. That is that we are going to host a winners battle as well. Okay. Sorry, winners battle as well. And all the winners are going to get to play a quiz, and that can be soon. So we'll let you know very soon. So stay tuned. And winners, the game has just begun.
Let's move ahead to the prize distribution of previous session. Previous session was conducted on 30th of November, and the topic was hematology images. That was the last session of hematology. And in that session, we have the following winners, and the winner of that session is, let's move on to the winner.
Screen is visible, sir, now?
Yeah, it is visible. Yeah. So the winner of last session is Dr. Hemant. Congrats, Dr. Hemant. It was great having you as the winner for the quiz. So Hemat Images, which was conducted on November 20th. Dr. Hemant is the winner, and he'll be getting an Amazon voucher also, which is a cash prize. So congrats, Dr. Hemant.
Congratulations.
And let's
Congrats,
see.
Hemant.
Yeah. So the other second place was backed by Dr. Arna, and third place was backed by Dr. Ashish. So congrats, Dr. Arna and Dr. Ashish.
Right. And guys, don't worry. We have little surprises for you as well. The second and the third winners. So stay tuned.
Let's move on with the recap part of today's quiz. So over to you, Dr. Rupal and Dr. Manoj.
Right. Thank you.
Yes, sir. Yeah. So there was a question on deviated nasal septum. As we know, this is an easy topic itself, but I want to highlight that many of them got it wrong. The answer was there is no intervention needed because normally the DNS is seen in 50 to 60% of the population. They are asymptomatic. Like they do not have any headache or epistaxis or any nasal congestion symptoms. Hence, we do not prefer any intervention to be done. So the most common cause for DNS is bird trauma, and the investigation modality for it is nasal endoscopy, which is one of the best technique to diagnose. Or we may have some Porter's test and spatula test. So the treatment includes mucosal section known as SMR, which was preferred in the earlier days, but it is not done now because this SMR procedure is often has a complication of saddle nose deformity. Hence, this technique is not used now, and the incision used here is Killian's incision, whereas nowadays the technique of choice is septoplasty, which is the preferred technique now, and the incision here is termed as Freer's incision. And the next concept will be explained by Dr. Rupal. Over to you, Rupal.
All right. Thank you. All right. So, guys, over here in front of your screen, you can see the anatomy, right? And the basic part where people can, or you guys can, not forget or get confused. That would be just the part where it says nasal spine or frontal bone, right? So you might mistake it with the lacrimal bone. It is nothing like that. So all in this anatomy, all you have to remember is that there is no lacrimal bone contribution. In the nose, there is no lacrimal bone contribution. All right. So with that, I am moving to you, Dr. Manoj.
Yeah. Here, as we know, this is a confusing thing to remember which wave is what. So to simplify it, we have mainly two views, that is occipitofrontal angle and occipitomental angle. In occipitofrontal is nothing but the X-ray beams pass from the occipitofrontal bone, which is also known as a Caldwell view. Here, the main sinus, which we do not see clearly, is maxillary sinus. To say that maxillary sinus we cannot see it clearly. As occipitomental angle, we can see clearly with the frontal sinus, and we here we can have two waves, Waters waves and Peres waves. The only difference is the patient, when he opens the mouth, it is called as Peres wave in order to see the penoid sinus. So this is the main difference we have between Waters and Peres.
Okay. So guys, as you remember in the quiz, where we had a little riddle for you. So, I work in silence, though I am in your head. I am in your nose. See, there is something in your nose. But I don't breathe. I send signals. It is in your nose and it sends signals. The right answer for this is olfactory epithelium. Now, most of you would have, like, or few of you who would have mistakenly thought that it could be cranial nerve. Well, it could have been, but the cranial nerve is a intracranial nerve, and it is not a intranasal nerve. It's not in your nose. And getting with this riddle, Dr. Manoj, what do you have for us next?
I think just to complete a quick recap for this session. Thanks.
All right, thank you guys. Thank you for lending a ear to us.
So this was a very good recall session for those people who have revised recently or have prepared ENT since a long time. Also for those who have come prepared also, it's a good testing session also. So I hope you guys have enjoyed this show. So team RMD along with me and Dr. Rupal and Dr. Manoj have made this fun exercise very funny. So when you solve QBank, it is very difficult because you don't have any entertainment source. But when you attempt JuxtaMed quiz, you have PYQs along with some source of entertainment. So it becomes like a gameplay. Okay, so learning becomes fun. So if you enjoy this, you can follow us on various platforms. We are on Instagram as JuxtaMed quiz. We are on Twitter, that is X also. We are on other platforms. Dr. Rupal will share the details.
Sure, definitely. And I would like to add like few more points over here for you guys. The fact is that we are trying to show you a different perspective of the medical community. Over here, we just want to be innovative in all the fields of mind, and being a little innovative and creative just improves your knowledge as well as your skill. So come, tune in, follow us, and you'll see, just check them out. No one is telling you to do much, but just check them out. They're worth it.
Yeah.
And I
So
think this will surely improve the speed. I think we are
yeah, this
trying
will improve.
to make them
Right,
attempt
right.
in 25 seconds. So obviously the speed will be increased.
Yes.
Right. So we'll come up with the next session. Next session details will be announced on our social media platforms, especially Telegram, WhatsApp, Instagram channels. Okay, so stay updated and we'll let you know the details. We'll be coming up live again in 2 or 3 days and we'll be giving you the topic 48 hours in advance. Okay, so that you can come prepared. So winner of this quiz, Dr. Hemant, please contact us for the Amazon voucher and cash prize. So
It's
thank you guys.
Vamshi, yes, sir.
Oh, sorry, Vamshi. Okay. Okay.
And guys, you can share your Insta handles or wherever, guys who are winners and, don't want to show your face or some shyness or want to be mysterious, however you please, just let us know. professionally so that we know you are a real person, not faking it. All
Okay, fine.
right.
Okay, everyone, thank you. We'll be live again in 2 or 3 days.